Hello everyone and welcome to the very important session where we are going to have a discussion on that what are the most likely questions to be asked from the anatomy in upcoming FMGE July 2025 examination. So the first topic which is favorite for the examination is the anatomy of the brachial plexus. Anatomically this topic is important, but also that what if there is the involvement of roots in the injury, trunks, division or the cords and ultimately to the branches like in the form of the Erb's palsy, the Klumpke's palsy, the outcomes of the median, ulnar, or the radial nerve. So be ready for this kind of the examination even this year too. Second is the triangle of neck. You know why triangle of neck are very commonly asked in the FMGE examination because they contain the vital structures like the carotid artery, the internal jugular vein, and the cranial nerve. So it is having a very high clinical relevance in the surgeries, biopsies, and in the emergencies. And what it is very frequently asked or tested is the image based questions in the form of the diagram or in the form of the one lining MCQs. So, what obviously you have to remember each and everything regarding from the content and the boundaries related to both anterior and the posterior triangles of the neck. So, this question on the triangles of the neck has been repeated in the past FMGE paper almost every year, and this time also it is expected to be asked. The third one, obviously, is the cavernous sinus. Now, what makes this topic one of the hot topic for the examiner to ask because it contains the multiple cranial nerves like third, fourth, V1, V2, and sixth. So it is easy to get converted this sort of a topic into a question. And cavernous sinus thrombosis is a deadly clinical condition, and that is the reason why it is very, very frequently asked in the form of both clinical scenarios as well as image based questions. So the third one, obviously, the topic is cavernous sinus that you have to remember. The fourth one is the skull foramen, and the structures which are passing out of it. You already are aware of this that they transmit the cranial nerve and vessels which are vital for the clinical anatomy, and that is the reason why it is frequently asked with the questions like structures passing through this type of the MCQs. Now, what they used to do is that they highlight one of the foramina and then they ask that all of the following structures are passing through this except or which of the following is the structure passing through it. So, repeated in FMG examination in particular are the foramen rotundum, the foramen ovale, and the jugular foramen contents. This time also it is considered to be a very vital topic for you that could be placed in the examination. Then are the dermatomes and the myotomes. It helps to localize the lesion in the spinal cord or the root lesion clinically. And that is the reason why it is frequently asked in the examination in the form of the diagram or in the form of the clinical based MCQ. So it is common in trauma, herniated disc, even in the nerve injuries, and that is why it is having a very high clinical and the exam relevance. So be ready for the dermatomes, particularly the specific one that at the level of T10 is particularly important because it is lying at the level of the umbilicus, the inguinal canal, the L1 level, which is signifying the inguinal levels. So this is something that you have to remember in the form of motor function as well as for the tendon reflexes. Be ready for these kind of the examination because it is very, very important for making the clinical diagnosis. Then the sixth topic obviously is the portosystemic anastomosis, and it is key to understand the complications of the portal hypertension. So clinically, this thing is linked with caput medusae, esophageal varices, and the hemorrhoid, and that is the reason why it is very, very frequently asked, both in the theory as well as in the clinical based MCQs. So easy to frame, like questions like identify the site or the clinical feature, like questions. So that is the reason why the portosystemic anastomotic related questions, even in these examinations, are more likely to be asked. Then is the brachial artery and its branches, because they are usually asked in context to the associated injury to the bone. Like in case of supracondylar fracture of the humerus, what is the name of the artery? The branch of the brachial artery which is involved in the profunda hemorrhage. Identify the artery which is used in the blood pressure measurement. The brachial artery divides at the level of which anatomical landmark? So these are the kind of the questions which they ask repeatedly because it is considered to be a very, very important question. Then obviously the question which even in this year is going to be asked out of this topic, which is perineum and the urogenital diaphragm. The muscles which are responsible for the formation of the deep perineal pouch, the structures which are passing through the urogenital diaphragm, episiotomy cuts through which perineal structures, perineal body is formed by the fusion of which of the following muscles, in rupture of the membranous urethra, urine collect in which space? So these are all the questions which are asked out of this particular topic. And even this year also, this kind of the question out of this topic is going to be repeated again. Every cranial nerve is important, like glossopharyngeal nerve, vagus nerve, the trigeminal nerve are equally important, but it is the facial nerve which is most commonly asked, because facial nerve exits the skull through which of the foramen. It is considered to be one of the most commonly asked questions. And which nerve is damaged in Bell's palsy? What are the features of the Bell's palsy? Then all of the muscles of the facial expression are supplied by which of the following nerve? The nerve passing through the parotid but not supplying the parotid gland is, identify the branch of the facial nerve which is supplying the orbicularis oculi. So these are all the questions where they can highlight one of the branch and then they can ask you directly in the form of a diagrammatic representation. Then the next important, very important topic is the development of the heart and the aortic arch derivatives. The questions like which aortic arch give rise to ductus arteriosus, then persistent truncus arteriosus is due to the failure of what? Derivative. Which of the following is the derivative of the third aortic arch? Then aorticopulmonary septum is derived from which of the following embryonic tissue? Which condition results from the abnormal neural crest migration? So these are the kind of the question which you already know are asked every year. And this topic in particular, that the development of the heart and the aortic arch derivatives, is something you can expect the question this year too. Another topic out of which the question is most likely to be expected is the histology of GIT, the respiratory tract, or the cartilages differences. So frequently these are asked in the form of the spotters or the image-based question in the FMGE examination. They are high yield because the epithelium type, it changes along the tract, like esophagus is different, the stomach is different, intestines are different, and then they continue to ask you about the differentiation in between the hyaline, elastic, and the fibrocartilages microscopically. So when these conditions are tied to clinical conditions like the Barrett esophagus, the smokers, or the bronchial metaplasia, then these kind of the questions become relevant and much easier for the examiner to, then these kind of the questions become relevant to be asked in the form of the MCQ patterns. So don't forget that the histology of the GIT, respiratory tract, cartilages, or even the lymphoid organs are likely to be kept this year too. Another one is the presence of the inguinal canal and the descent of the testes related anatomy, because it is central to understanding in between the indirect versus direct inguinal hernia, and that is why they used to ask the question out of it. So frequently tested in the clinical scenarios involving hernias or the testicular descent defect. Why this topic is particularly asked? Because it is linked to the surgeries, undescended testes, or even the hydrocele formation. And you have seen the kind of the question that has been asked previously, like which structure passes through the deep inguinal ring, covering of the testes is derived from the abdominal wall, what forms the floor of the inguinal canal, which muscle gives rise to the cremastic fascia. So all these are the sort of the questions which can be asked out of this particular topic. That is why this topic is important for you to remember. Then the areas of the brain and their function, obviously, because this year also they are going to have a question out of this. Why? Because it is the core of the neuroanatomy which helps in correlating the lesion with the clinical sign. Like if there is aphasia, then where is the lesion? If there is paralysis, then where is the lesion? Frequently asked question out of this is match the area with the function, or identification on the basis of the diagram also. So it is having a high clinical value in stroke, head injury, and even in the tumor localization. That is why it is clinically relevant. And it often appears in the image based MCQ where the brain cross sections are shown and then the highlighted structure is asked about. So this is why this topic is particularly important for you to remember the areas of the brain and their specific function, on the basis of which the MCQs are very likely to be kept in your examination. Then one of the most practical question is the related to the joint anatomy. So frequently asked in the clinical scenarios, like in case of dislocations, or they can be asked in the form of the fractures. But more importantly, from the anatomical point of view, it is high yield in the spotters, like which of the following is what type of the joint, like the shoulder, which is a ball and socket type of the joint. Then they ask about the histology of that particular joint. Now they can additionally ask you about what are the names of the ligaments which present the abnormal movement of that joint in particular. So joint anatomy is very important. Each and every joint you should be knowing about the type, the structures, and the muscles around it. One of the topic which is very importantly kept in your examination is the lesions in the circle of Willis. You already know that this question is going to be asked even in this year too, in even in this year examination too. And what makes it more important is that they can even give you a CTA image on the basis of which they can ask you that where exactly the hemorrhage is located, because they are trying to convert this circle of Willis related question into a key clinical one. So be ready for these kind of the images where they can ask you any question related to the berry aneurysm where the CT images are also provided. Then another topic is the larynx and the recurrent laryngeal nerve related anatomy. You know why the larynx and recurrent laryngeal nerve questions are commonly asked, particularly in the FMGE examination, because it is very frequently injured during thyroid surgery as well as in neck surgery, because they are very frequently injured during thyroid surgeries. So it makes it clinically relevant. And the common MCQ on the nerve supply to the intrinsic laryngeal muscles has been asked multiple of the time. So you know all sort of the questions which are commonly asked, like all intrinsic muscles of the larynx are supplied by the nerve which is injured during thyroidectomy, causing hoarseness. Which laryngeal muscle is spared in recurrent laryngeal nerve injury? The muscle which is responsible for tensing the vocal cords. All these are the kind of the questions that you already are aware of, and be ready for this topic to be asked this year even too. Then another very important for clinical identification of the specific lesion or the syndrome along the spinal cord is likely to be kept in your examination. You all have heard about Brown-Séquard syndrome, the anterior cord syndrome. So these are easy to frame with contrasting sensory versus motor loss patterns, and that is the reason why they used to ask the questions out of it. So how they used to frame the question, like image-based question, case presentation, or identify the syndrome-like question. For example, the loss of pain and temperature on opposite side with same side motor loss, what does it suggest? Like if there is a syndrome which is caused by anterior spinal artery occlusion, what is the name of the syndrome? Which spinal cord syndrome shows preserved vibration but lost motor function? So all these are the kind of the question that you already are aware of. There are multiple ways in which the examiner can make the question appear confusing, but once you are ready with the basics of these vertebral column and the spinal lesions and the syndromes associated with this spinal lesions, then you already are aware with the answer for this. It makes it much easier. Another one is the brain stem lesion. You know, there is a possibility of the affection of the multiple cranial nerves along with the long tract, so making localization very exam friendly. And this is the reason why it is very frequently asked through the crossed findings. Like if I say that which brain stem syndrome, there is a involvement of cranial nerve 6 and cranial nerve 7. As you know, it is Milliard Gubler syndrome. If there is ipsilateral facial loss, contralateral body pain, temperature loss points towards 2, then you already know that it is Wallenbach syndrome. So these are the kind of the questions which they specifically and repeatedly are asked related to the brainstem lesion. So you should be knowing about each and every syndrome related to this, like Weber syndrome, Milliard-Gubler syndrome, Wallenbach syndrome. Then another question has been asked multiple of the time is the structures, is the anatomy related to the diaphragm? Because the main nerve which is supplying the diaphragm is has been asked multiple of the times. The congenital diaphragmatic hernia is due to the failure of the closure of which of the following has been asked multiple of the times. The pain from the diaphragm is referred to which of the following dermatome? Then these are the sort of the questions which they ask in relation to the diaphragmatic anatomy. Then, specifically for the last 3 to 4 years, they are giving you one of the important muscle around any joint, and then they highlight that muscles, and then they ask you about what is the name of that muscle. You should be knowing about every muscle along with its origin and insertion around the hip joint, the knee joint, and the ankle joint in particular. Then in the upper limb, you should be knowing about the important muscles around the shoulder, elbow. So these are the muscles which are likely to be highlighted in your examination, and then they will ask you what is the name of the muscle. You know, till date, it is the tibialis anterior muscle, which they have not asked by giving you the image, and there is a likely possibility that they can ask this time. And then finally, the triangles around the abdomen. You know, these are the important surgical landmarks like Hasselbeck triangle, the Petit triangle, and frequently asked are the hernia related anatomy, that means direct versus indirect. So, how their questions are usually appearing like identify the triangle or what are the structures which are passing through these triangle. And it makes it clinically relevant in the open surgery trauma or even the lumbar hernia diagnosis. You already know how the questions are asked, like what are the boundaries of the Hasselbeck triangle? Which triangle is the site for the lumbar hernia? The medial border of a Hasselbeck triangle is formed by. So all these are the sort of the questions that has been asked multiple of the time. And this is the topic number 21. You should know me knowing everything through and through regarding this topic, that is abdominal triangles. So for the students who are appearing in this July session of FMGE 2025, these are the 21 most important topics from the anatomy out of which the questions are likely to be kept in your examinations. If you are aware of at least 14 topics out of this 21 through and through, that means you have already passed the examination. So all the best for your future examination. Please join our Telegram group. The link is provided to you in the description. All the best.